Most patients come to my clinic thinking that this problem will never go away. For that, surgery is the only option. In this video, I want to explain what frozen shoulder really is. I want to clear some common myths and talk about what actually helps in recovery. So what is frozen shoulder? Frozen shoulder is otherwise called adhesive capsulitis. It is a condition where the soft tissue around the shoulder joint becomes thick, tight and inflamed. Because of this, the pain increases and the shoulder movements gradually reduces. It most commonly affects people around the age of 40 to 60 years old, and it is very common in people who have diabetes, hypothyroidism, after prolonged rest or immobilization of your shoulder. One important thing you need to remember is it is a painful condition, but it is not dangerous. Frozen shoulder progresses in stages, usually about 3 stages. In the early stage, pain is the main complaint. Here the night pain or the pain during your sleep is a very typical symptom in cases of early periarthritis. In the next stage, stiffness becomes more prominent. In this stage, the simple daily activities like combing your hair, wearing your clothes, things like reaching behind your back becomes very difficult. The last stage is your thawing stage where the pain and range of movements slowly get regained. So natural history of this problem is basically even if there is not much significant treatment given, people can recover in a span of about 2 years. But our whole intention of giving a treatment at the right stage is to reduce the time that the patient or the person having this problem, the suffering is reduced. With proper treatment and proper time, most patients gradually improve. It's very important to know that gradual improvement is the right or the most important thing for you to notice. So coming to the myths regarding frozen shoulder. Myth number 1. Frozen shoulder always requires surgery. This is a very common myth. In reality, most of the frozen shoulder patients recover gradually with time without surgery. Treatment usually includes pain control, activity modification, and stage appropriate physiotherapy. In some cases, we also give a shoulder injections which can reduce the time of suffering or time of pain, and hence the patient recovers slightly faster. Surgery is required in a very small percentage of patients who, despite all the conservative treatment that we do not recover pain-free, useful range of movements. In my experience, most of the patients recover well gradually again with proper treatment that is started early and consistent regular exercise therapy. Coming to myth number 2, more pain means more exercise. Many patients believe that forcing exercises despite pain will speed up recovery. In frozen shoulder, this is not true. And during the painful stage, if forced exercises are undergone, this can aggravate the inflammation inside your joint and hence worsen your condition. So exercises should be stage specific. Pain should guide your therapy and not ego. So the treatment should work with your shoulder and not against it. Myth number 3, frozen shoulder is permanent. Many patients worry that their shoulder will be stiff forever. So like I said, frozen shoulder has a natural course. With proper management at the right stage, most patients recover even without any kind of surgery. Recovery takes time, but improvement does happen in majority of the cases. So having patience is an important part of your treatment. Myth number 4, physiotherapy alone is enough. So physiotherapy is a very important part of your treatment protocol, but that alone will not help you. So most important thing is pain control, activity modification and injections when required. They also play a very important role in your treatment. Hence, treatment should be individualized to that particular patient and which will help in recovery faster for that particular patient.